Is it the clinician's role to monitor the sexual health of their patients? More attention has been placed on sexual health since the World Health Organization issued a statement on sexual well-being more than 25 years ago. A dialogue about sexual well-being should be an essential part of routine patient care. Unfortunately, for a variety of reasons, the dialogue between clinicians and their patients all too often does not occur. This video will show a typical encounter between a clinician and patient when the topic of sexual health comes up during a routine visit. In this specific instance, the patient is complaining of decreased desire. It will subsequently show how common barriers to communication can be overcome. First, a little background on decreased sexual desire. In the National Health and Social Life Survey, 43% of women reported having some type of sexual dysfunction. The most common complaint was lack of interest in sex, reported by approximately 30% of women. Many studies confirm that the most common sexual complaint among women is low libido or decreased desire, lay terms frequently used to describe hypoactive sexual desire disorder. What is HSDD? The DSM-4-TR defines hypoactive sexual desire disorder, or HSDD, as deficiency or absence of sexual fantasies and desire for sexual activity that results in marked distress or interpersonal difficulty and is not caused by a psychiatric or medical condition or medication. In a recent population-based study called Prevalence of Female Sexual Problems Associated with Distress and Determinants of Treatment Seeking, or PRESIDE, approximately 1 in 10 women reported low sexual desire with associated distress, which may be HSDD. Low sexual desire with associated distress is the most commonly reported female sexual complaint. Although some of your patients may be concerned about their low libido or decreased sexual desire and would like to get help for this condition, many are reluctant to initiate the conversation. Only 10% of women seek medical consultation for sexual problems, despite the fact that 90% believe their healthcare provider should ask about sexual health issues. There are many reasons patients may not bring up the topic of decreased sexual desire. Some are concerned their healthcare provider will simply dismiss the complaint. Others are embarrassed to bring up the subject or think it will be a waste of their healthcare provider's time. There are some patients who believe that having low libido is a normal part of aging. There are also those individuals who do not consider female sexual dysfunction to be a medical condition. The actor-supported enactment you are about to see will demonstrate some of the communication barriers between clinicians and their patients with decreased sexual desire.
Well, everything seems fine at this time. I have your prescription for your mammogram. Now, my nurse mentioned to me that you had some questions about your libido. Is there anything you'd like to talk to me about at this time?
There is something. Well, you see, I just don't feel like myself anymore. I've been feeling this way for quite some time. I'm just not interested in sex anymore. It's getting to the point where it's starting to create tension between me and my husband.
I see. Please, go on.
I feel so embarrassed bringing this up, but it's becoming a real problem in my marriage. I'm just never in the mood anymore. I mean, it wasn't a problem when we were first married. Don't get me wrong, I still love my husband very much. I just hope that I don't have some type of illness or disease, you know, something medical that's making me feel this way.
Patients are often reluctant or hesitant to mention their decreased desire, which is why the World Health Organization maintains it's the clinician's responsibility to initiate a discussion on sexual well-being. There are several reasons why patients are unwilling to discuss their sexual concerns during a routine office visit. Here are some of the hints patients may give when they want to talk about their decreased sexual desire but are too embarrassed to be direct. I have no libido. My partner complains I have no interest in sex. I don't feel right. My partner wants me to ask if there is any treatment. In our enactment, the patient has given a strong indication that she wants to talk about her decreased desire. Let's see how the healthcare provider responds.
I don't know what's wrong.
Well, there are several factors that can contribute to decreased desire. I didn't note any abnormalities on your physical exam. I'll do some blood work to rule out any underlying medical conditions.
Okay, thanks. I was embarrassed to discuss my decreased desire with my doctor, and I didn't really understand what she was saying about the test and exam, but I didn't want to ask any questions that made me look uninformed. So I guess I'll just let it go and see if things get better. I mean, it's probably just stress. Things have been so hectic at work and with the kids after school activities. It's probably just a phase I'm going through. I hope that in time it'll pass and I'll start to feel like myself again.
There were several problems with the dialogue we just saw enacted. First of all, it was the patient, not the clinician, who brought up the subject. A reason for the clinician's reluctance to discuss the patient's decreased desire might have been her discomfort with the topic. There are several barriers to good clinician-patient communication about sexual health. Most clinicians wait for their patients to bring up the topic of sexual health instead of initiating the discussion themselves. In one recent survey, the majority of clinicians said they asked less than 1/4 of their patients whether they had any questions about their sexual health. Many clinicians are reluctant to start the conversation because time is limited during office visits, and clinicians want to make certain that other medical conditions are addressed. Another factor is inadequate training in the area of sexual health, which leaves clinicians feeling unqualified to discuss the subject. Clinicians may not feel comfortable discussing sexual health, especially when there are differences in gender, age, culture, race, and so forth. Clinicians tend to not inquire about the sexual health of their patients who are younger than 18 or older than 60 to 65, or patients who are not married. Some clinicians would never ask a woman, "Are you satisfied with your sex life?" thinking that it is none of their business. Therefore, unless the patient brings up the topic of sexual health, it will not be discussed. One way to promote a dialogue about sexual well-being is to become more knowledgeable in the area of sexual health. Many clinicians have limited knowledge of the different types of female sexual dysfunction. A survey of internal medicine residents showed 90% had never screened or diagnosed HSDD, and the typical medical school devotes only 3 to 10 hours to the broader subject of sexual health. As a result, many clinicians have inadequate information to diagnose and treat the condition. In contrast, when clinicians are well informed, they feel more comfortable initiating a discussion. When clinicians are able to take the time to ask patients about their sexual well-being, using language that patients understand, and asking open-ended questions that draw out the discussion, a surprising amount of information can be uncovered. Also, when clinicians are well informed, they feel more comfortable initiating a discussion. Here are some suggestions for initiating a dialogue about decreased sexual desire. First of all, it is important to use common language that helps the patient identify her symptoms. To put the patient at ease, you can ask questions about sexual activity in the review of systems. An individual patient norm can then be established. You can start with general questions about sexual activity and then become more specific. For instance, you can ask the patient, "Is everything okay at home? Are you sexually active? Do you ever experience pain during intercourse? Do you have any sexual concerns? Is anything bothering you?" Once you have established a lack of interest in sex, you can put the patient at ease by asking a question that lets her know she is not alone, such as, "Did you know that up to 1/3 of women have a reduced desire for sex?" Then you can get more specific, asking, "Have you noticed a decrease in your level of sexual desire?" The next line of questioning should determine whether the patient's decreased desire causes her distress. By definition, HSDD must cause marked distress or interpersonal difficulty. You can ask the patient, "How do you feel about your lack of interest?" Unlike women who become aroused after their partner has initiated sex, individuals with HSDD are rarely receptive to sexual advances. To determine if this is the case, you can ask the patient, "Can you become aroused during sex? Do you turn your partner down when you are approached? If so, do you often decline to participate when your partner initiates sexual activity? When you and your partner begin to have sex, how do you feel about wanting sex to continue?" If you are not comfortable treating patients with decreased desire, you should be able to offer your patient a list of providers in the area who are well versed in these types of disorders. Now let's get back to our office visit enactment and see how the dialogue would go if we applied all of the communication strategies we just discussed.
I'd like to ask you a few questions about your overall health. Is everything all right?
Everything's fine.
Eating well, sleeping well?
Yes, for the most part.
And how about your relationship?
I just don't seem to be interested in sex anymore.
Now, why do you think that is?
I don't understand it. I mean, I feel fine physically. I just don't have the desire. I don't know what's wrong with me.
How bothered are you by your decreased desire?
It didn't used to bother me. I thought that my low desire was something that was temporary. I thought things would work themselves out once the kids went to school, but my decreasing desire seems to be getting worse, and I feel terrible about it. I know my husband's upset, and I'm worried.
How long have you felt this way?
Let me think. About 9 years. Ever since our first son was born.
Did you have any problems during delivery?
No, not at all.
Any pain or discomfort during intercourse?
No.
Well, it sounds like your decreased desire is causing you distress. In your case, this may be a medical condition called hypoactive sexual desire disorder, or HSDD. That's a term used to describe someone experiencing decreased sexual desire, which is not caused by a physical condition or a medication, and they are bothered by the decrease.
This dialogue did not take much time, yet it gave the patient the opportunity to discuss her decreased desire and allowed her to describe how her condition is affecting her. By initiating a dialogue between you and your patients, you'll find that they are more willing to open up and discuss their sexual health concerns. Sexual well-being is essential to a patient's overall health. Thank you for joining us.